So I'll be talking about is my post-op protocol correct? And I think the entire discussion is about the enemy at the door. The enemy at the door here is endophthalmitis. And if you look at the central pictures, and anybody would say that they're dealing with an endophthalmitis. But if you look at the picture to the right side or to the left side, like a viral endothelitis or a TAS can be a mimic to this. And all of us want to avoid all these things. Now, if you look at the standard post-op protocol, which is generally followed, and we use a topical steroids post cataract surgery and topical antibiotics for some period of time. And sometimes there are some patients who have been treated with systemic antibiotics and other medications. But ideally, actually, post-operative antibiotics are not approved for cataract surgery. And your follow-up is, this is the standard protocol majority of us follow, day 1, day 5 to 7, the second visit, and 2 to 4 weeks later. And when in doubt, we ask them for calling for a more frequent follow-up. I think of all the factors which limit the incidence of endophthalmitis, I think the usage of perioperative povidone has definitely a level of evidence. And a very good draping with isolation of eyelids and eyelashes and a meticulous sterile operation theater preparations are definitely going to limit the incidence of endophthalmitis. But what are the factors post-operatively? So you have taken enough condition in the intraoperatively and post-operative. What are the factors which we look into? One is the usage of topical antibiotics. Then we'll look into the usage of intracameral antibiotics. And also we'll look into the usage of the systemic antibiotics. The goal of a topical antibiotic is to reduce the conjunctival bacterial load, thereby lowering the risk of intraocular contamination. But it does not have a strong evidence of support in terms of clinical this thing. So, in fact, if you look into in spite of the fact it does not have a clinical support, if you look at the ASARS survey, 97% of the people use topical antibiotics post-operatively, at least for a period of 2 weeks post-operatively. This was an interesting study from the Indian Journal of Ophthalmology with the LBP group, where they injected intracameral antibiotics in one group, and they treated with intracameral antibiotics and post-operative antibiotics, topical antibiotics, and at the end of it, they have realized that they did not have any difference in the incidence of occurrence of endophthalmitis, thereby questioning the use of post-operative topical antibiotics. Now the intracameral antibiotics have been now come into the work because of the randomized control study which was done by the ESCRS group way back in 2006. And once they published, and they have come out with a result saying that it almost decreased fivefold there is a decrease of fivefold in the rate of culture positive endophthalmitis. And the rationale for using it is, if you look at in spite of adequate preoperative and the post-operative, intraoperative aseptic protocols we follow, we have a bacterial contamination as high as 31%. And so the idea is to inject the antibiotics at the end of the surgery to kill these microbes. But remember that intracameral antibiotics are not without any complication. These are the list of the complications. And in fact, because of the compounding errors of the pharmacies, post-intracameral antibiotics, people still had endophthalmitis. Now, systemic antibiotics do have some role, and these are some of the indications where you see patients with chronic infections, immunocompromised patients, prolonged surgeries or repeat surgeries where people tend to use systemic antibiotics. Now, that was as far as the literature part of it is concerned. Now, let's see what is the practice patterns in our country right now. And this was the AIOC survey talking about the antibiotic prophylaxis in cataract surgery to prevent endophthalmitis. More than 95% of them have responded saying that they use post-operative antibiotics, and nearly 50% of them are using for a period of at least 4 weeks. Now, patching is done only if the patient is having a peripheral blood block, and they've also said that patching is done only for a few hours, and prolonged patching, there is a high risk of endophthalmitis. And if you look at this particular comparison between the American population, American group and the Indian group, and you can see that majority of them use preoperative and perioperative antibiotics, post-operative topical antibiotics. They also use intravitreal antibiotics also. But the only difference is the choice of antibiotics, and we use moxifloxacin possibly because moxifloxacin tends to cover more of a gram-negative, and that is the reason why, because in India we have more of gram-negative bacterial endophthalmitis also, and that's why the moxifloxacin is the preferred choice. And in practice, there are nearly 40% of the people who still use subconjunctival injections, and 50% of the people, close to 50% are using post-operative antibiotics. And when they ask the question, when do you use an intracameral antibiotic, majority of them said that in high-risk patients in these conditions like a PC break, prolonged surgery, or elderly individual or immunocompromised patients, they tend to use these intracameral antibiotics. Now, following the ESCRS study, the Indian group, the Sharma et al., started evaluating the intracameral cefuroxime, and they recommended to using it only in the high-risk patients. But the Arvind group, I think the Haripriya et al., once they started using the intracameral moxifloxacin, they recommended to use it routinely for every patient who's undergoing a cataract surgery, and they reported that at least threefold reduction in the incidence of endophthalmitis following the SICS, and sixfold decrease in the reduction in the occurrence of endophthalmitis following phacoemulsification. So the take-home message is, I think it goes without saying that the perioperative use of povidone iodine definitely has a level 1 evidence, and isolation of the eyelids and eyelashes and meticulous sterile operation theater preparations are extremely essential. Avoid a prolonged patching, that is extremely important, patients. Topical antibiotics, in spite of the fact we have a less level of evidence, but it's one of the most common practice, and people are using topical antibiotics. Intracameral antibiotics are extremely gaining popularity, and probably I think we should think about using them in high-risk patients. And systemic antibiotics also have a role in a group of high-risk patients. But in order to prevent endophthalmitis and to play it safe, I think what we are actually doing is we are causing a risk of antibiotic resistance. We are increasing the risk of antibiotic resistance. That is what we need to keep in mind.